This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2024. Distal femoral fractures pose significant challenges in treatment, with nonunions being a common issue when using standard fixation techniques. Far cortical locking or FCL constructs have been proposed as a potential improvement over traditional locking bridge plates. However, there is no clear evidence on whether FCL provides better outcomes. To address this uncertainty, a multi-center randomized trial was conducted across 16 centers involving adult patients with AO-OTA type 33A or 33C distal femoral fractures. Patients were randomly assigned to receive either FCL or standard locking plate fixation, with the primary outcome focusing on a hierarchical composite measure of radiographic and clinical healing at 3 months. A total of 193 patients participated in the study, where 96 received FCL screws and 97 received standard screws. Patients treated with FCL screws showed better outcomes in 51% of pairwise comparisons, while those with standard screws had better outcomes in 44% of pairwise comparisons. The win ratio was used to compare outcomes, and results indicated that patients with FCL screws had a win ratio of 1.18, though this difference was not statistically significant. Importantly, both groups demonstrated similar radiographic healing and function index for trauma scores. Further, there were no significant differences in SF36 physical component summary scores at 3 months or in the change in these scores at 12 months post-fixation. This trial found that FCL and standard fixation methods provided similar clinical and radiographic healing outcomes for distal femoral fractures, suggesting that FCL screws are a viable alternative but not a definitive improvement over standard techniques.